Mastering the NCLEX exam requires a sharp eye for prioritization, and one of your most essential tools is Maslow's hierarchy of needs. This framework acts as a roadmap, helping nurses quickly determine which patient care issues demand immediate action and which can wait. Imagine a pyramid structure where the most fundamental survival needs sit at the very base, supporting everything else above them. As you climb higher toward the peak, the needs transition from basic biological requirements to complex personal and emotional growth. For your NCLEX exams, remember this golden rule. The lower the level on the pyramid, the higher the priority for your intervention. This means that physiological needs are the absolute foundation, always taking precedence over emotional or psychosocial concerns. Let us start at the base. Physiological needs. These are the non-negotiable requirements for human survival. Think of these as the biological basics: airway patency, effective breathing, circulation, and adequate oxygenation. This category also includes essential life-sustaining factors like hydration, proper nutrition, temperature regulation, and pain management. If these basic physiological needs are not met, the patient simply cannot survive, making them your top priority in any scenario. Consider a patient struggling to breathe. They will always be a higher priority than a patient who is merely anxious. Severe bleeding, low oxygen saturation, or unstable vital signs are all red flags that demand your immediate, undivided attention. Whenever you encounter an NCLEX question involving airway obstruction or respiratory distress, prioritize those physiological needs immediately. Uncontrolled hemorrhage or signs of shock also fall squarely into this critical base level of the hierarchy. Always scan your options for these life-threatening indicators before considering any other psychosocial or emotional patient needs. Once those critical physiological needs are stabilized, your next focus shifts to the second level: safety needs. Safety is all about protection and maintaining a secure environment for your patient to heal without further harm. This level encompasses a wide range of clinical concerns, including fall prevention and strict infection control protocols. It also involves managing suicidal ideation, preventing seizures, and identifying any environmental hazards in the patient room. For instance, a confused patient attempting to climb out of bed is a major safety priority due to the risk of injury. You must intervene to protect that patient, as their physical safety is now the most pressing concern after their survival is assured. A suicidal patient also falls under this safety category, as protecting them from self-harm becomes your primary nursing responsibility. Always remember that safety is the next logical step after physiological stability is confirmed in your clinical assessment. Moving up the pyramid, we reach the third level, love and belonging, which focuses on human connection. This includes the need for healthy emotional relationships, robust support systems, and meaningful social interactions. Patients often feel isolated or lonely during a hospital stay, which can significantly impact their overall recovery process. A patient expressing sadness because their family members have not visited is a classic example of a need in this category. While emotional support is undeniably important for a patient, these needs are addressed only after physiological and safety concerns are stable. Never prioritize a social need over a life-threatening airway or safety issue, no matter how distressed the patient appears. Once the patient feels connected and supported, we move to the fourth level, esteem needs. Esteem needs involve a sense of personal confidence, independence, self-respect, and a feeling of accomplishment. Illness, injury, or the sudden loss of independence can deeply damage a patient's self-esteem and sense of self-worth. Think of a patient who feels embarrassed or ashamed about needing assistance with basic tasks like bathing or grooming. Nurses address these esteem needs by actively promoting patient dignity and encouraging as much independence as safely possible. By supporting their autonomy, you help the patient regain a sense of control over their own life and recovery. Finally, we reach the peak of the pyramid, self-actualization, the highest level of human development. This level is about achieving personal goals, finding deeper purpose, spiritual growth, and reaching one's full potential. Patients at this stage are focused on meaning, creativity, and the fulfillment of their long-term aspirations. An example might be a patient discussing their life goals, personal achievements, or their journey towards spiritual peace. While these needs are vital for a person's quality of life, they remain the lowest priority during emergencies. When you are in the middle of a crisis, you must keep your eyes on the base of the pyramid. Always ask yourself, which patient faces the greatest immediate threat to their survival right now? If you are stuck between two choices, use the simple, powerful mantra, physiological before psychological. If the body cannot survive, then higher-level needs like self-esteem or self-actualization simply cannot be addressed. This hierarchy is not just for exams. It is a critical thinking tool that guides your daily clinical practice. It forces you to pause and evaluate the urgency of every patient's situation before you take action. Start by checking the airway, breathing, and circulation. Then move up to safety and protection. Only after those basics are secured should you turn your attention to the patient's emotional and social needs. This systematic approach ensures that you are always providing the safest and most effective care possible. Understanding this framework will help you navigate even the most complex prioritization questions on the NCLEX. When you see a list of patient scenarios, visualize the pyramid and rank them from the base to the top. The patient with the physiological issue will always be the one you attend to first, every single time. Keep this structure in your mind, and you will approach your exam with much greater confidence and clarity. Prioritization is a skill that improves with practice, and Maslow is your best starting point for that journey. Stay focused on the most basic survival needs first, and you will be well prepared for any test question. Remember, the pyramid is your guide to safe, effective, and life-saving nursing interventions in the clinical setting. By mastering these 5 levels, you demonstrate that you understand the true essence of patient-centered, priority-based care. Trust the hierarchy, apply it consistently, and you will see your ability to answer NCLEX questions improve dramatically. You now have the tools to categorize needs and make the right decision when every second counts for your patient. Keep practicing this method, and you will be ready to succeed on your exam and in your future nursing career.